Hello everyone, myself HIMANI Sharma from RPIIT campus. In today's class, I discuss about the differential WBC count. First is the introduction. Principle: the differential WBC count is performed to determine the relative number of each type of WBC in the blood. In disease state, a particular white blood cells type show the increase in number in the blood. Method is the manual method, electronic cell counter. Material and instruments: whole blood using the EDTA as anticoagulant or capillary blood drawn from a finger or toe puncture, glass slides, microscope, alcohol 70%, lancets, Leishman stains, its composition, Leishman stains 0.15 gram methyl alcohol 100 ml, titrate Leishman stain with 100 ml methyl alcohol, acetone free, filter and keep well stoppered, immersion oils, differential cell counts. Next is the procedure: prepare the blood smear, clean the two slide, one to be covered with the blood film and one to be used as separator. Clean the finger with alcohol, allow it to dry and then prick it with a disposable lancet to obtain a drop of blood. Make a fine touch of one end of a slide with the drop of blood. Only a small amount is required. Place the edge of the other slide on the surface of the first slide just in front of drop of blood at an angle of 45 degrees Celsius. Draw the spreader back until it make contact with the drop of blood. Push the spreader slowly and smoothly to the other end of the slide. Allow the film to dry at room temperature, that is, the blood smear should be air dried. They should be also labeled immediately with the student's name and the date at the end of slide. There are the slides. High HCT, small angles, low HCT, large angle. Staining the blood smear: by put the dried slide on a staining rack. The blood smear should be stained as soon as possible. Certainly within 1 to 2 hours, carefully drop the Leishman's stain into the blood film until the film is covered. Allow the stain to act for 1 to 2 minutes and add the distilled water to the stain and mix by blowing. This give dilution of 1:1 or 1:2. The diluted stain should act for 15 to 30 minutes, then wash it off with the distilled water. Continue the washing until the film has pink colored. Shake off excess water and allow it to dry at room temperature. Examination of the stained smear: for examining the blood smear, a microscope with a the low power objections and an oil immersion objective is necessary. Place the slide on the microscope stage. Examine the blood smear using the low power objectives. Choose an area where there are the plenty of the WBC. This area is usually located near the wedge shape end of the blood smear. Place a drop of immersion oil on the selected site and carefully change the oil immersion objectives. Perform the differential cell count at the same time. Examine the morphology of the WBC. Each WBC seen and record on a differential cell counter until 100 WBC have been counted. For instance, if 25 of the 100 WBC were lymphocytes, then the percentage of lymphocytes is 25%. The normal range percentage of different types of WBC is as follows: neutrophils is 50 to 70%, eosinophil 1 to 4%, basophils 0.4%, monocyte 2 to 8%, lymphocytes between the 20 to 40%. Thank you for watching. In today's class, I discuss about the staining of the smear and how to make slide prepare the blood smear, their material and instrument, method, principle. Thank you for watching.